deaths. And I'd like to urge everyone watching to join the Save Lives, Clean Your Hands initiative. Together we can save lives. Also, we at RID would like to call your attention to hand hygiene moment number 5, the importance of cleaning your hands after touching surfaces in the hospitals. Hand hygiene is critically important, but there needs to be more emphasis on how to keep your hands from becoming recontaminated before you reach the patient. Stand in an emergency room and watch the most meticulous physicians and nurses clean their hands, pull on gloves, and then reach up and pull open the privacy curtain to see the next patient. That curtain is seldom changed and is laden with bacteria, so now caregivers' hands and gloves are contaminated. Research shows that many surfaces in hospitals are heavily contaminated with drug-resistant bacteria like MRSA and VRE. A recent study done at Boston University examining over 1,100 patients' rooms in 20 hospitals all up and down the eastern seaboard of the U.S. found that over half the surfaces in patients' rooms that are supposed to be cleaned after one patient is discharged from the hospital and before the next one is admitted to that room were left untouched by cleaners. Doorknobs, bed rails, phones, television monitors were particularly heavily contaminated, much more so than toilet seats, for example. We know that about 3/4 of surfaces in hospitals are contaminated with these drug-resistant bacteria. And research also reminds us that if a caregiver walks into the room of a patient who is unknowingly colonized with one of these drug-resistant bugs, and the caregiver has no direct patient contact, but simply touches the light switch, pulls open a drawer, touches an IV pole, and over the bed table, 42% of the time, that caregiver's hands or gloves are contaminated even though there has been no direct patient contact. And that underscores the importance of cleaning hands every time you touch one of those surfaces. A recent study done at Tufts University found that the #1 predictor of which patients pick up, that is, become colonized with vancomycin-resistant enterococcus, the #1 predictor is who occupied that patient's room in the preceding 2 weeks. It's the presence of VRE lingering on the surfaces long after that previous patient was discharged. And in fact, the researchers found that that VRE survived through, on average, 2.8 terminal cleanings. So we can't underscore enough the importance of being reminded that once you touch those surfaces, your hands are recontaminated, and of course, the importance of effective environmental cleaning. Researchers at Rush Medical College in Chicago found that even after terminal cleaning, many surfaces in a patient's room were contaminated again with vancomycin-resistant enterococcus. But after the researchers worked with the cleaning staff to identify the usually overlooked objects and the importance of rigorously cleaning and using a drench and wait process rather than the quick spray and wipe, drenching and waiting at least 3 minutes, they were able to reduce the spread of VRE to other patients by 2/3, at least 66%. Very impressive reduction in VRE colonization. Yet another study, this one done at a 9-bed ICU in Great Britain, found that over half the patients who picked up MRSA in this ICU picked up a strain that was not present on another patient there at the time. In other words, we've always assumed that caregivers carry the bugs directly from one patient to the next on their hands. But in this case, what the study showed was that caregivers were picking up these bacteria off surfaces where the bacteria had been deposited or shed by patients long since out of the ICU. So it's really important to recognize the importance of cleaning your hands after touching those surfaces, and once again, the efficacy of more rigorous environmental cleaning to prevent the spread of these drug-resistant bacteria. Now, if thorough cleaning is an important aspect of preventing drug-resistant bacteria for MRSA and VRE. It is the first line of defense with Clostridium difficile, also known as C. diff. This is a particularly big problem because it's the rampant nature of the diarrhea that makes C. diff so hard to control in the hospital. Only a very small percentage of patients come into the hospital carrying this spore in their gastrointestinal system. Many more pick it up after they've been hospitalized. How does that happen? Oral fecal contamination. In other words, patients pick up traces of those C. diff spores left behind by another patient, and then, without thinking, touch their lips, or more often, their meal tray arrives and they pick up their roll or their cookie or their sandwich and eat it without cleaning their hands. So let me underscore again that in the case of C. diff, not only is rigorous environmental cleaning essential, but we also need to remind patients of the importance of their own hand hygiene. And with that in mind, we've created a card that we can put on patients' trays. It says, please clean your hands before eating this meal and avoid placing your utensils on any surface except your plate. These are available at RID. I hope you will contact us. We don't make money doing this. We just want to make sure you have this card for your patients. And we also have a cleaning card. This is very supportive of the Save Lives, Clean Your Hands initiative. This is a card in English and other languages that simplifies but conveys all the important research on how to clean environmental surfaces in the hospital to ensure that once you clean your hands will remain uncontaminated until you reach the patient. And of course, we'd also like to underscore the importance of educating everyone in the hospital who may be unaware that cleaning with alcohol-based cleaners may not protect patients from C. diff. We need to use soap and water when C. diff is in the environment. So once again, I'd like to congratulate everyone who's joined the Save Lives, Clean Your Hands initiative and encourage everyone who's thinking about it to please join with us. Together we can save lives.